Hi, I'm Donna Brooks from Original Body Wisdom Yoga Therapy and Somatic Movement Therapy. And I'm here today to help you with your pelvic floor and with any pain you might be having in your tailbone. So it's important to know what the tailbone is. That's why I have my little model here. And it's just this little piece that comes off your sacrum. There's a joint here. And your tailbone can move very slightly, but it can move forward and back, kind of swings like a hinge, and a little bit from side to side. A lot of us have stuckness in the tailbone, and that not only can create pain, but it can inhibit your pelvic floor's natural movement because important pelvic floor muscles are attached to the tailbone. So, as a somatic movement therapist and educator, I want to give you simple, gentle, and yet profound ways to release tension in your body and to have better function. So, what I'm going to have you do is just take a little assessment of yourself in this moment, a non judgmental, curious assessment of what you feel like in your body right now. Where and how do you feel you're breathing? Does it feel full and deep? Do you feel like you have some resistance to an even and easy breath? Are there places that feel tight? And you're not trying to make yourself feel better or breathe better. You're just meeting yourself where you are now. One of the secrets of your pelvic floor is that it has a breathing movement. But for that breathing movement to operate functionally, you have to have a free tailbone. So you can notice if there seems to be a movement in your pelvic floor and your tail as you breathe. And if there is, great. If there's not, don't worry about it. It's surprisingly simple to get fluidity and freedom in that part of your body. Next, what I'd like you to do is just take a little assessment of how you feel standing here. So does your weight feel even on both of your feet? Do you feel grounded? What about these bones here, your ilium, commonly called the hip bones? Do they feel even, or does one feel further up towards your waist than the other? Or maybe you feel a little rotated with one coming forward more than the other. All normal, not optimal, but very normal. And we'll see if in just a few simple movements you can make changes that positively impact your tailbone, your pelvic floor, and the health of your overall body. So I'm going to turn to the camera just so you can see how far down on my spine I touch my tailbone. It's really right above my anus. And I have muscle attachments to my glutes, my big buttock muscles here. So I'm just gonna kind of spread my cheeks, push in and spread a little right down at that tailbone to start to kind of create some openness, some possibility for the tailbone to have freedom. So just do that a little bit. You're not going to strain. This is one of the principles of working with somatic movement is we don't strain. We're looking for things to be fluid. Then after you've done that, take another look at your body and see if anything's changed. You might already notice a difference in how grounded you feel, or even it might feel that your weight is more evenly distributed between both of your feet. Next, what we're going to do are some pelvic tilts. So you can do these exercises lying down. I'm going to do this standing so you can see me more clearly. So just do a pelvic tilt, which basically would mean rounding your lower back, bringing it to the floor if you're lying down, and then arching your lower back away from the floor, bringing your belly forward. And just notice what that feels like. And most of us do the pelvic tilts either from really using the muscles of the lower back or from our abdominal muscles. Not wrong, just habit, what we normally do. And I'm going to ask you if instead of doing it from your back and your abdominals, if you could find that little tailbone And imagine that little tailbone grows into a long tail that comes between your legs, right? It comes between your legs and comes forward. And that forward movement between your legs makes your back arch, and then your tail swings back and down. So you're doing the same arching movement with your back, arching and rounding or flattening movement with your back, but you're just imagining your tail like a little flap that can extend out and back or forward and in. And what you're looking for is a different kind of feeling because you're initiating this movement with your tailbone. So if you don't think you're feeling anything different, go back to the first movement and feel what that feels like if you're using your back end or your abdominals, and then compare that to your tail. And if you're starting to notice a difference by moving your tail, you're starting to gain control of movement in this joint. And you will be well on your way towards having better pelvic floor function and less pain, maybe even no pain in your tailbone. So before we sign off, just take a look again. Notice if your breathing has changed. Notice if the weight on your feet has changed. Notice if you feel any more evenness from side to side in the ilium. And see if there's a little bit of a hint of breathing in your pelvic floor. And if you have any questions for me, please visit my website at originalbodywisdom.com. I look forward to meeting you.